We really need to work on viewing the food as nourishing and safe rather than potentially bothersome and oh my God, is this going to flare me? Like we need to change the narrative behind that and your thoughts and your beliefs. And that's going to take some time. That's going to take some work.
Welcome to Pelvic POV with your hosts and doctors of physical therapy, Amanda Neary and Hannah Meyer. Hey, pelvic freaks. Welcome back to another episode of Pelvic POV.
We're your freaks for us and we're freaks for your pelvis, baby.
And welcome, Callie, to Pelvic POV.
Hey, freaks.
I love it.
Love that. Making yourself right at home.
Callie, we have been talking through Instagram. This is our first time meeting. I'm so excited because you are very passionate about a topic that we cover a lot, but we have not touched on the podcast like at all. So let me go ahead and introduce Callie. This is Callie Krajcir, aka Callie K, the Bladder Dietitian, which I'm sure a lot of our pelvic freaks are going to be super interested in because we're going to talk about topics like the IC diet and stuff like that. So Callie, can you talk to us a little bit about your history with IC, kind of how you got into this treatment?
Totally. I'll try to keep it a bit concise because it's a 25-year journey. So as far back as I can remember, I had bladder pain. You know, I was a kid. Every time I peed, it felt like I was peeing fire or like Tabasco sauce and, you know, all the spasms and everything. And having those symptoms as a kid was really difficult because no kids around me were saying like, ow, my bladder hurts. So I probably said it to one person and they were like, what the hell? And I was just like, okay, I'm not going to talk about this again. So for the longest time, I just kind of pushed through the pain, got into sports. I ended up being a 3-sport athlete in high school and just kind of, again, learned to live with it, push through it. I kind of found some of my triggers as I went, like dehydration absolutely destroyed me. So made sure to drink water. I got into my first urologist at age 18 when I was a freshman in college. It was this older woman in my area, and the only takeaway I got from that visit was that she shamed me because I shaved down there. And I wanted to cry because I was like, oh my God, this older woman just like made fun of me.
Wow. That's terrible.
It was not a good experience, but she was like, all right, your symptoms, they could be related to IC, but we want to do, you know, the cystoscopy with hydrodistension. So when they put you under and they kind of blow your bladder up and look at it. Mm-hmm. The bladder wall looked totally fine during that procedure, but based on my symptoms, she was like, I don't know what else it could be, so it's probably IC. After that diagnosis, I just kind of started this really long, exhausting treatment process, and that was when I was a freshman in college. I was playing volleyball in college, so a lot of stress, a lot of pressure to perform, a lot of changes in life. You know, that's when you kind of start drinking alcohol. That's when you have a ton of like just normal school-related stress. You're eating different things. You're meeting new people. So it was a really stressful time in my life, and trying to navigate seeing different doctors and trying to find treatments that gave me relief was really difficult. And I saw lots of different urologists, urogynecologists. I tried all the medications, the instillations, Botox. I had very bad vulvodynia at the time, and I even had a vestibulectomy in college that I wish I didn't do, but that's a story for another day. To make a long story short, none of the medical treatments ever made me better. A lot of them made me feel worse. So there was a point where I just like threw my hands up and I said, I'm done with this. You know, I need to figure this out on my own. And over the course of maybe 2 to 3 years, I was able to identify that my nervous system was stuck in a state of fight or flight. Stress was always my number one trigger. And I realized, okay, I'm a high anxiety person. I'm type A, I'm perfectionist, people pleaser, all of those things. I don't know how to relax. I don't know how to let go of control. So I started to connect the dots of, okay, when I'm stressed, I'm clenching my pelvic floor. I'm holding my tension in my pelvic floor. And I went to pelvic PT and I learned that my muscles were extremely tight. And that was most likely causing my bladder pain and the frequency and urgency that I developed over the past couple of years, or the last few years of my journey. And so through a combination of pelvic PT, using a pelvic wand every day, and regulating my nervous system or minimizing stress and learning how to cope with stress, I went from 24/7 bladder burning, frequency urgency to being completely symptom free. And that's where I'm at now.
Cheers.
Cheers. Yeah, it's really exciting. And how I got into this work is I was a registered dietitian working in just the classic hospital setting. I absolutely hated it. I got laid off during the pandemic. I knew that I wanted to help other people with IC and bladder conditions. So I kind of took the jump to start my own business. And that was about 4 or 5 years ago. And since then, I've worked with hundreds of people, and we are helping them get relief from their symptoms and starting to like live their lives again and get the freedom to live. So yeah,
Wow.
that's kind of the story.
Thanks for sharing your story. I mean, I'm sorry it took so long to get there, but it's remarkable the progress you were able to make in that 1.5 year span once you kind of figured out where to go.
I guess we should also probably mention that Callie also has a podcast. And it's called the ICU podcast, which is awesome. And I've already referred a patient to listen to your podcast, and she had nothing but great things to say. She was like, it made me feel so validated. She was super anxious in our appointment. And I was like, why don't you listen to this podcast and see what you can get from it? And then let's talk about it when you come in for your next session. And she did. And oh my God, from session 1 to the next session, it gave her so much more peace of mind. So it was great.
I would love to hear what episode she listened to, but
yeah,
there's literally 86 or so episodes out now. If you're new to it, I'd recommend listening to the newer ones because the first 2 seasons kind of sucked because it was my first time podcasting. You guys know what I mean?
We know what you mean.
Content is good, but the quality's not.
No, we had this conversation with someone who visited us last week, and we were like, what episodes did you listen to? Was it episode 1? Because please go easy on us. But, you know, you got to start somewhere. And I'm sure we're going to look back on these episodes and be like, wow, we should have done this instead. But
you guys are light years ahead of where I was when I first started my podcast.
So getting into what interstitial cystitis and overactive bladder actually is, I think that would be really beneficial for our listeners to hear. So can you give a little overview of these conditions and some common symptoms that you would see in them?
Yeah, for sure. And you guys are welcome to chime in. I'm sure together we can come up with a good
100%
explanation. But I'll start with interstitial cystitis. So this presents really similarly to a urinary tract infection. So, you know, the bladder burning, bladder pain, the frequency, the urgency, feeling like you have to run to the toilet. You might be up at night having to use the bathroom. You may experience like a feeling of pressure. It kind of presents differently for a lot of people, but the difference between IC and a UTI is with IC, there isn't an infection present.
Yeah.
That's, you know, the classic presentation of IC. Some people don't have pain. Some people don't have frequency and urgency. I didn't for a really long time.
I was going to say a lot of times what we see with IC, and you kind of mentioned it with your history, is a tight pelvic floor. So I feel like that over time, your pelvic floor can respond to like the IC condition and the way you're managing that condition, and then lead into the frequency and urgency symptoms later on. So that makes sense that you said not everyone has it, but it could be contributed more with like a tight pelvic floor and impaired pelvic floor muscle coordination. So
I personally feel like a lot of people get misdiagnosed with IC and they really just have pelvic floor dysfunction, but that is just my opinion, not a doctor.
No, 100%, 100%. Can you actually talk about, because I had some questions, you said bladder installation, so that sparked my brain. What are some of the treatments that are typically offered first line for IC instead of pelvic floor PT? I know you said bladder installations. That's a big O that I hear. And then Botox?
Yeah. I can definitely talk about that. I forgot to mention there's a small portion of people who get the IC diagnosis who have what they call Hunter's lesions. So it's like these open wounds on the bladder wall that can be seen during the cystoscopy. I believe you can see them without the hydrodistension if you're just in office. I don't know if you guys know something I don't, but also they can see them under the hydrodistension where they're blowing it up. And for those people, it's recommended by the American Urologic Association to get those treated as soon as possible. There's like fulguration, there's steroid injections you can do. That's straight from the AUA. And in terms of treatments for IC, mostly for the people, like, I guess you could say with or without lesions. Yeah, there are lots of procedures that can be done. A lot of them are invasive, but in my experience, my doctors were happy to recommend them and do them right away. And that's something that I don't always agree with. But yeah, installation. So this is where they put medication in your bladder through a catheter and you kind of hold it there for a certain period of time. My experience with installations, I mean, it was inconsistent for me. I tried multiple rounds of it. Sometimes I felt better afterwards. Sometimes I felt the same. Sometimes I felt like my urethra was super irritated and I would be in a flare afterwards. So that's a really common one people are recommended.
That's similar to what I see with people that get, I see.
Yeah.
Similar to what I see when I have patients that do bladder installations. That's very inconsistent, but it's like, what else can I do when they're first coming into pelvic floor PT and they don't know that pelvic floor PT is a treatment?
Yeah. And it should be like one of the first treatments, right?
That's why we're here.
Yeah. I was also offered Botox. You could get Botox in your pelvic floor or your bladder. I went for the pelvic floor option because obviously my pelvic floor was the main contributor of my symptoms. I had that done twice, and the first time was pretty sweet because I was on my mom's insurance in college and they covered it. But the second time I had to pay out of pocket and it was like over $1,000. And the fact that it only helped me a little bit, it didn't make me want to do it again if I had to pay for it. So that was something that, a lot of pros and cons there. And then some people get Botox in their bladder, but there is a risk of developing like retention where you're not able to pee on your own and you have to catheterize yourself. And I've been talking to a couple of people lately who had that procedure and they had to self-cath, and it can be kind of a bit traumatic of an experience. So there's definitely benefits versus risks with all of these, more invasive type procedures.
Yeah,
Absolutely.
I'm so happy that we're talking that pelvic floor PT is an option because it is a way easier option than dealing with all of those risks and side effects from other procedures, at least for a first try.
Yeah. Well, when I tell people, like, if I could go back and, like, if I got diagnosed with IC again, let's say, what would I do differently than I did the first time? Well, I would get on a pelvic floor PT's schedule because sometimes you guys are hard to get into depending on the location. There's like a months long waiting list to get into the person I was seeing recently. And I would do that immediately before I even like started doing other things in my lifestyle. But yeah, I am a huge, huge advocate for people to get into pelvic floor PT because if your pelvic floor is tight or it's not working functionally or the way that it's supposed to, like, that's something that needs to be addressed.
And it's interesting that pelvic floor wasn't recommended for this before Botox because we're working on hypertonicity with pelvic floor therapy in most cases. And if we're really at a standstill, Botox would then be a second line of treatment that we would use, like we would use in neurological cases as well. So there is a time and a place for it in some cases, but for it to be the first line of approach is really interesting. And
I have a confession.
Yeah.
It was recommended along the line, and I just did not understand how it could help me. I thought, it is in my bladder. How is pelvic floor physical therapy going to help me with my bladder symptoms? So the office called me to schedule, and I was like, I'm sorry, I don't want to do this. And I literally hung up because I didn't know. I didn't understand the connection. So had somebody explained it to me back then and like just made me understand it, I think I would have started sooner and really believed in it.
That's super fair. And I was just talking to someone else about how half of our job is really raising awareness and letting people know what we actually do some of the times, especially when we're talking to strangers who have never heard of pelvic floor PT. It's a lot of advocacy that we're still having to do, especially in the US, where it hasn't been as common or integrated into care.
It just blows me away that there are doctors that don't even mention it. I was talking to a couple people recently that are like, yeah, my My doctor told me to follow the IC diet and they recommended installations or whatever. And they never even checked me for pelvic floor dysfunction. They never even mentioned going to PT. And that's a shame.
Yeah.
I mean, we see this with pretty much every one of our patient populations. There's like half of physicians that refer to us and half that don't. And it's very interesting.
Well, and to your point too, like there's a difference between a physician saying, okay, why don't you try pelvic floor PT? This could help versus being like, try pelvic floor PT. This is why it could help because you're showing these symptoms and this is what they do there. They don't really know exactly what we do. They just know, and some physicians will know that we help. So then they refer to us. So I think doing things like this, like starting your podcast and our podcast and then collaborating is great to get that advocacy out there so hopefully more people have pelvic floor PT as a first line of treatment and they understand that it helps in a bigger way.
For sure. I've had people say that they didn't know about it until they heard it from me and now they're doing it. And I'm like, that is so sad, but really, I'm glad that I'm doing this. It makes me just feel good about it.
Yeah. So can you talk about where diet fits into all of this now?
Yeah, I for sure can. So we have what is called the IC diet, and it is, honestly, it shoves down our throats.
Yeah. I get very anxious this is why I'm excited to have you on the podcast because I have showed it to people before. And I say, you don't have to follow this super strictly, but here's a reference of maybe some things that you can look out for that could be a trigger for you. And if that's a trigger for you, like maybe let's try taking that out of your diet for a little bit and see if it can give you some more immediate relief while we continue to work on your pelvic floor. But that's kind of how I use it. I don't say like, here it is, follow this to your exact extent, but I'm so excited to hear you talk about the IC diet.
Yeah, no, I think that approach is fine. I think it's appropriate. I have a problem where like doctors are giving this handout to people and saying like, you have to follow this forever. You need to stop. Like, what if we said to doctors, you have to stop drinking alcohol, drinking coffee, having carbonated beverages. You have to not eat citrus,
chocolate
products. You can't have pizza ever again. You can't have pasta ever again. Spicy foods. Like how do they expect us to take that? I think it's really, it's overwhelming. I remember I was feeling really overwhelmed and devastated when I was told that. And if we back up and think like, what is the IC diet? Okay, it's this diet that tells you to restrict those items, but where did it come from? Well, there was a study done in 2007 at Long Island University, and they sent out this questionnaire to a couple hundred people asking them, what do you think your bladder is sensitive to, if anything? And they got about 104, I think, responses back. And through that data, they created this IC diet list. And the purpose of it, they even say this in their published literature, is it's meant to be used to guide an elimination diet. It's not meant to be a long-term solution. And I think that's one of the biggest myths in the IC community is that you don't have to follow this forever. You're not meant to. The IC diet is a restrictive diet. I mean, you have a couple of versions of it out there. There's a version that's like, okay, these are the most bothersome foods. These are the least bothersome foods. And at least it's like kind of on the shorter end. But there's this bigger 3-column list where it's like so many different things that, you're not supposed to eat or it's bad. And people start creating these rules in their head and they start viewing these foods as bad. And that is just throwing them into the cycle of like the pain fear cycle. It's feeding into that fight, flight, or freeze state because you're perceiving it as a threat. And then, that can contribute to like holding tension in your pelvic floor. It can contribute to gut health issues, fatigue. Like it kind of has so many more consequences than we realize. I see a lot of people who are eating the same 10 to 15 safe foods for months to even years. I've had so many people tell me I've been eating the same thing for years. And when that happens, you see people developing nutrient deficiencies. Makes a lot of sense. You're not eating variety. A lot of people are losing weight unintentionally. And then a lot of people are developing food fear. And it's really frustrating for me because this IC diet isn't backed by really strong evidence. There have been subsequent questionnaire type studies that have been conducted, but again, these are questionnaires. They leave room for a lot of bias. Like the people who are more diet sensitive may be more motivated to complete these studies. There are small sample sizes, at least in that first study. So, I mean, my belief is that there is a time and a place for the IC diet. I think when someone is in an active flare, things are really irritated, I think, yeah, it could be appropriate to kind of lay off of those top irritants, the alcohol, the coffee, the citrus, the tomatoes, but it's not meant to be a long-term solution.
It reminds me almost of like a diagnostic tool, because I know some functional health practices will give really restrictive diets to kind of rule things out. And with IC, maybe you have IC, but for example, with some of our patients with like bladder urgency and symptoms like that, if they cut out all of these bladder irritants, they'll notice a reduction in their symptoms. But is that realistic to do long term? No. So then we have to find a balance of like behavioral patterns, lifestyles that make sense for them, that support incorporating all of those things into their diet. So just hearing, I didn't actually know the full diet until you just listed it. Just hearing that, it doesn't sound realistic for most people to do that. And I can totally see how that would trigger patients and honestly develop just like unhealthy relationships with food and diet in general. So I can see where it would be useful, but I think we would have to be really careful about recommending that for people. And we, not us as pelvic floor PTs, because we're not dietitians, but just people in their profession recommending that.
Yeah, I like that you mentioned the pain fear cycle, because when you were talking about your history at the beginning of the episode, you were saying how downregulating your nervous system was one of the biggest things that helped you. I can't even imagine like having this IC diet handout and I'm going out to eat to Guilt Bar like we did last weekend and just being like, oh my God, like I can't have anything. Like, what am I going to get? Like, I would be like looking at the menu beforehand to make sure I can. I would want to get like a drink, but then I would like not want to have a flare or be running to the bathroom. And that would stress me out. And that's only going to hurt your symptoms more and make them worse.
Exactly. I was going to bring up the social component to it because you're right. Going out to eat is a disaster. Eating outside of your house, like even if you go to a friend's house for dinner, it's just, there's so many mental hurdles you have to go through. And like, there's always paranoia present of like, oh, are they cooking with some sort of bad ingredient that's going to trigger me? And then you also deal with people who maybe you go out to eat or you're somewhere in a social setting and like, you're not having a drink or you're asking questions to the waiter. And then people that you know start asking questions like, well, why aren't you drinking? Why can't you have that? And then you feel like you have to give them an answer. And it's just emotionally and mentally draining.
I used to, okay, this is totally different scale, but kind of relates. I used to not eat meat for 2 years. And I remember the hardest thing for me was going to like Thanksgiving or holidays or like a friend's house or like buffets at weddings. And then I just wouldn't be able to eat anything. So I can imagine people following the specific diet being like so stressed at weddings, so stressed at holidays, things like that. And I can't, yeah. So I'm glad we're talking about this.
Yeah. And for OAB, it's not necessarily they're recommended to follow the IC diet, but it's kind of similar where doctors are recommending you to remove like the top things like the alcohol, the citrus, the tomato. So it's kind of similar, but I feel like it's a little less restrictive, but it depends. But I kind of wanted to share next, like my findings in working with, a lot of people with IC and OAB symptoms. And the thing that really surprises people is the majority of people I've worked with these symptoms end up not being diet sensitive, like at all. So a lot of people are thinking that they are, and really there's some sort of non-diet trigger at play, whether that's stress or a pelvic floor issue or hormone issue or something else that's causing the symptoms. It's really easy for us to have a flare up and then think like, well, what did I do differently today? Well, I just ate lunch. Was it the banana that I had? Like, it's really easy to put the blame on the food and not dig deeper into, well, am I ovulating? Did I have a stressful thing happened yesterday, like a fight with a friend or something like that, or a stressful day at work. And I think I really encourage people to dig deeper past the food, because usually for people who have diet sensitivity, because that is valid, I don't want to invalidate anybody, but that's usually a symptom of another underlying issue, like the things that I'm talking about here. And the top two things I'm noticing among my clients is a dysregulated nervous system and or pelvic floor dysfunction. Those two are usually seen together, at least in my clients. So once we address that underlying issue, the diet sensitivity usually disappears in addition to their symptoms.
And taking that one step further, in people with pelvic floor dysfunction, a dysregulated nervous system is often the underlying cause of that. So it's almost this trickle down. It's always the nervous system that we're ultimately getting back to. And I think educating on that and really demonstrating that to patients is going to be a lifelong struggle in our professions, because it's not something that's tactile and we have to conceptualize it differently.
Yeah.
Remember that meme? It was like, instead of a nervous system, can we have just a super chill system? I'm like, yes. So, Callie, we mentioned one pretty big myth with IC, which is you have to follow the IC diet. Specifically, here it is. Do you have any other, maybe two more big myths that stick out to you when it comes to IC?
I was trying to really use my brain in the 10 minutes before we got on this podcast about myths. And I mean, I was thinking like, just people who assume that diet is causing their symptoms. I mean, same thing I was just saying, like, you need to dig a step deeper of like, well, what is the underlying issue here that is making you diet sensitive? So I guess that could be a myth, that diet is like the number one cause of bladder symptoms. It's really not, in my opinion. Mm-hmm. Another one would be like, if a food triggers your symptoms once, you can never eat it again.
Oh, that's a good one.
That's not true. I was kind of explaining earlier, like if you are sensitive to something, that doesn't mean you're always going to be sensitive to it. There's usually a lot behind why you're sensitive to it. And sometimes people will be able to eat a food on a certain day where, let's say, they have low stress levels, they're feeling good, but maybe in a week later, maybe they're on their period and their symptoms are increased, and maybe that diet tolerance is a little bit lower. Like, there's usually a lot of factors that go into it. So I would say, don't assume that if a food triggers you one time that like you can never eat it again.
Okay. So then going off of that, because we're talking about food fear kind of now, what would you say your tip is? Let's say this is a patient or a client that has been following the IC diet, or maybe they found out, okay, tomatoes are my trigger, so now I'm not eating tomatoes. I'm avoiding pastas, delicious pasta. I'm avoiding anything that involves tomatoes. What are your immediate tips to maybe start introducing those foods again for people that have developed more food fear?
Yeah, that's a really good question. I would say you really need to work towards calming your nervous system and teaching it safety. So when I'm working with my clients in my program, we are having most people spend the first 4 to 6 weeks of working together on nervous system regulation practices. That could be anything from meditation to visualization to lots of other tools, maybe some somatic tracking when they're having flare-ups. We really need to work on viewing the food as nourishing and safe rather than potentially bothersome and, oh my God, is this going to flare me? Like, we need to change the narrative behind that and your thoughts and your beliefs. And that's going to take some time. That's going to take some work. And working with someone like me, obviously optimal, but I know that not everybody can. So if you are dealing with food fear, I mean, if you can work with a therapist too, to work through some of that fear, that could be helpful. But if you're on your own, you could use tools like visualization. Visualize you eating that food that you currently fear and imagine it going really well. Imagine it's going through your digestive system and it's really nourishing your bladder. It's making it really happy and kind of visualizing that best case scenario. And I always think, like, if someone said this to me 10 years ago, I'd want to punch them in the face. Like, visualization, come on. It can be really powerful. And another tool that my clients have been using recently that actually just like stemmed from one person doing it and was really successful, and it just kind of caught on, was when you're trying a food that you are a little nervous about, if you have symptoms after you consume that food, do a couple rounds of some type of breathing technique. I love 4-7-8 breathing. So in for 4, hold for 7, out for 8. I'll do like 5 to 10 rounds. If your symptoms decrease even a little bit, that points towards it being a psychosomatic response, or it's a mind-body response, and the food really isn't the problem. Now, if you determine that the food is still a problem, okay, let's just back off it for a little bit. Maybe in a couple months, we can revisit that. But it's all about teaching that safety and not viewing the food as a threat, because your nervous system is going to protect you from the threat. And that's going to look very differently for everyone, but it might just be like, let's throw a bunch of symptoms at them so that they never eat this again.
I'm so happy you're on this podcast right now. So well worded. Mindset is everything. Like, we talk about this with witchcraft, okay? Like, we talk about witchcraft
sure
on this
do.
podcast. And we say, you know what? If you don't think it's going to work for you and you're really judgmental about it and you're like, no, I don't believe that the moon is going to affect anything in my life, then you know what? It's probably not going to work for you. But if you are putting intention behind your witchcraft or spells or whatever, then it's going to work. It's mindset.
100%. I'm a believer.
Such a 180 from bladder, but that's how I'm going to relate to that statement. Right, Amanda?
Yeah.
But yeah, no, you perfectly align with exactly how we treat. We talk about nervous system dysregulation pretty much all the time. We just did a stress episode about how stress impacts the body. It's crazy.
I think people need to hear it from multiple practitioners in order to fully believe it and make it stick. And I feel like I've been trying to create content on social media lately that's kind of like painting the picture of like, okay, your symptoms are really inconsistent. Your symptoms came on out of nowhere. Your symptoms get worse when you think about potentially, like, I don't know, something like travel or sex or exercise or eating something. Maybe your symptoms get better when you're on vacation or you're doing a joyful activity. Like, these are all signs that this is a neuroplastic symptom, or it is this is rooted in your nervous system, essentially.
Totally.
Exactly. I actually had a question really quick. Are you currently treating right now?
Yeah, I don't use the word treat because I'm like technically a nutrition coach.
Okay.
But
Coaching.
yes. So yes, I'm going to be reopening my Road to Remission program, and we're making some really big announcements at an open house that I'm doing on May 21st. So I'll give you, the gist is we redid our complete program. Like, our program is already really good, my Road to Remission program, but we are doing the first 6 weeks of the program is only dedicated to nervous system regulation. So I brought in a nervous system coach. She created all of these modules, and I just believe it's going to get people relief even faster. And the program's also going to serve people with IC, OAB, and just bladder symptoms in general if they don't have a diagnosis. So yeah, that's kind of the gist.
Awesome. So you're doing like virtual, so you have this program, and then are you having virtual like one-on-one meetings with people? How does it work exactly?
Yeah, it's just my Road to Remission program, because that is the most, in my opinion, that is the way for people to get the best results. I don't think like just doing a one-off, one-on-one call is going to get people relief. So yeah, no, the program is really changing people's lives, and I'm super passionate about it.
It's exciting.
Awesome.
It's exciting to have that alongside like maybe one of our patients coming to pelvic floor PT.
Absolutely. On that note, do you want to talk a little bit about where you collaborate with different providers in general, whether that's pelvic floor PTs or anyone else you're collaborating with?
Yeah, for sure. Like I said, huge advocate for pelvic PT. So if someone comes to me and they're like, I haven't been evaluated by a PT, I'm like, please go. I can help you find someone in your area if you need. There are some people that tell me like, I've been to PT before and it didn't really help, or I don't think I had like a great practitioner. So I usually encourage them to get another opinion, because for me, I didn't really get relief, or it didn't click for me until my fourth pelvic floor PT. Something about her, we just clicked and we vibe, and I love that. And so I always say like, give it a couple of tries. You just need to find the right fit for you. So you guys are like my very first recommendation. You know, some people, they need to work with some sort of therapist. They may need to do some pain reprocessing therapy, or, you know, there's lots of different therapy modalities out there. It just depends on the person. We have some dietitians come in that are experts in different, you know, areas of dietetics, maybe gut health, maybe we have someone that helps our clients with food fear, like an eating disorder type dietitian. So we do a lot with that. Yeah, I mean, that's kind of, it's mostly PTs and dietitians, but on occasion, like we might have a doctor or some sort of practitioner like that.
I love that you mentioned giving it a few tries too, because we've heard this before where someone will go to rehab and then they'll say physical therapy didn't work for me. And it's like, well, physical therapy is a profession. It does work. It might just be the provider you saw. Or that's like saying medicine doesn't work for me. It's like, we know medicine works, right? You just have to find the right fit. So I think that's really important that you're empowering people to use their own agency to kind of find the right fit for them too.
Yeah. Or people will say, I did physical therapy and it flared me. And it's like,
yes,
you guys can speak to that.
Yes. Oh my God. Okay. I want to hear what you say about that.
Yeah. So I've gotten some opinions from different PTs that I'm friends with. One of them was like, this is something you need to communicate to your physical therapist. You know, they may have just done too much, used too much pressure. Maybe you were just so upregulated that everything is really sensitive. And I was talking to another, she's more of a holistic PT, and she was telling me, if this is normal, if your symptoms don't subside or get better within like 72 hours after the visit, this is usually like a psychosomatic response versus like the time it takes for your muscles to kind of like adjust to the treatment that was done. So I mean, kind of different opinions. I would love to hear your guys' opinion though.
I was going to say this is something that happens all of the time, especially if someone, okay, I'm trying to think of a specific example. So maybe someone that's like not in a flare right now, but they're like, I heard pelvic floor PT helps. And then we do internal work and maybe an internal assessment, and then they're flared. And similar to what you said, if it doesn't go down within 72 hours, I like that actually, saying 72 hours. I usually say like, you know, a typical like a day or two after, you could have some muscle soreness. But if you're having like a flare up of your symptoms, like you're having that burning, like bladder pain, it's like wrapping around the abdomen, maybe going into your back, something like that, and it's lasting upwards to like a week, then it could be a nervous system response. And we need to work on some strategies like we mentioned already. So 100%, I think that's something we definitely need to mention, because that can be something that someone comes in first visit and they're like, nope, not doing this again. Like, I was fine before. Why am I doing this? I'm flared now. But there's a reason why pelvic floor PT works. Trust us, it will get better. Your pelvic floor PT could have done a little bit too much. I say like, okay, maybe we assessed all 3 layers last time. It flared you up. Let's just do the first layer. Let's just work on stretching of the first layer. Let's do like 4 minutes each side. And I talk people through it. We're not going to do longer than 4 minutes on each side. We'll be done in 8 minutes versus last time maybe we did 10. So I'm trying to help people by giving them like a sense of, okay, we're doing less than last time, I promise, and it won't be as much. And I feel like that helps them to calm down some. So it's pretty much both things.
Yeah.
Yeah.
I think the fear is really driving it for people who just are like, okay, it hurt, I flared, I'm not going back. It's like, no, stick with it. It is worth it. Trust me. Like you need to work through some of these muscle issues that you're having. You know, I recently went to PT. My symptoms are great, but I do still tend to hold my tension in my pelvic floor. So I like to keep up with it. And she was working on a tight muscle. I think it was, something, you guys.
Trader internist.
Yeah, that. And in the moment at the visit, it felt a little tense and tight, and she was just stretching it. But I went home, and I think the next day had sex, and it burned like crazy. And I was like, okay, don't freak out. This is probably related to the PT. So I emailed her, and she's like, oh yeah, that's normal. Let me know if it doesn't go away in like another day or two, but like it should go away. And it did go away. And after that, she adjusted her, what she was doing with me, and it was great. So I think that communication is absolutely essential, but like you need to have that established trust, because if you don't, like, this is such an intimate type of therapy that you just need it.
Mm-hmm. Yeah. Sometimes it takes us a while to even get to that layer to like work on that muscle that you mentioned, because it's so deep. But also, I always preface any internal work with patients that this is body work. So if you think about getting like a deep trigger point massage, you're going to be sore after that. But soreness in the pelvic floor might present differently. Your symptoms might be different. So pay attention to, like Hannah said, the timeline of how that comes down, because there is some degree of it that is normal after getting that deep body work. But it's always something we can adjust to. So communication is key.
Yeah. I was going to say pelvic floor is like a puzzle. So maybe I've been treating one patient and they can tolerate a lot of stretching, and we're doing all 3 layers on both sides, and they can tolerate that type. And maybe I'm doing that with a new patient. We're taking it slow, but in the moment they don't realize how much they can tolerate. It's their first time getting this treatment done. So we're always checking like, okay, what's your pain level? What's your pain rating? Like, what are your symptoms right now? To the best that we can, but we don't know maybe until the next day how much your body really could tolerate. So then we'll have to adjust. So that's you having that direct line of communication with your PT was great, so that she could adjust it quickly for your next session. I'm sure the next session was a lot better. So that's something that happens a lot though.
Definitely. And I am a pelvic wand user, so I'll use it a couple of days a week. And I always tell people this was the game changer for me personally. Like, I would go to PT once or twice a week and I would feel okay, but I still had symptoms. And it wasn't until I started using my wand consistently, like pretty much every day, that my symptoms literally just disappeared in a matter of a couple of weeks. So I don't know your opinions on that, but like, I'm a believer.
Yeah.
We love the wand. It's our favorite tool.
I do really like the wand. Do you still use it to that extent? Do you use it every day, or how often do you use it?
I'm more of like a 2 days a week type of person now.
Cool. Yeah, that's what I was going to say. I was going to say, usually to a certain point, you won't have to use it every day, but maybe if you had like a flare or something, you would want to pick it back up. But yeah, I think using it management wise is literally perfect. That's something where people could go wrong, is they'll stop using it because they're like, oh, I'm better now, which it happens. That's how I am sometimes with PT. But cool. So we have some raptor
fire.
Some raptor questions. So we have some rapid fire questions that we wanted to ask you. And I literally kind of got these by going through your Instagram and seeing what you've mentioned before. By the way, I stalked you. So are you ready?
Yes. And for the record, I didn't read the questions because I thought it would be more fun that way.
Yay,
okay. Beautiful. Okay, cool. What is the number one mistake you see people make holding them back from freedom from their bladder? So, number one mistake.
I would say not believing that they can get relief.
Okay. So good.
I don't know if that's where the post that you got it from, but in my opinion, if you don't believe you can get better, you probably won't. I think that's like the number one thing you need to start out with.
100%. Snaps for that. All right. Most surprising food trigger, or most common that people wouldn't expect?
Food trigger that people wouldn't. I mean, I feel like people are expecting it. Like, I would say alcohol is I'd say coffee, actually.
Coffee?
Probably. If somebody is going to be diet sensitive, it's usually coffee. But I don't know that that's unexpected.
I feel like tomatoes are kind of was a surprising one for me.
Yeah.
I didn't realize that until I looked at the IC diet, that tomatoes were a big trigger for people. And I randomly had a patient one time take tomatoes out, like kind of did like a little elimination diet, and it like completely resolved their symptoms because they were eating tomatoes like every single day.
Those Italians.
Yeah.
I can't get rid of them.
I'm watching the White Lotus Sicily right now, season 2. So I'm like full on like wanting to go to Italy right now.
Oh, I love that show so much.
It's
So good.
So good. Okay. Next question. What would you say is step 1 for people seeking relief from bladder pain? Like day 1, I'm in pain. What do I do?
I mean, there's a lot of things I would say here, but
You got this.
oh man, I would calm the nervous system. I would affirmations of safety. I'm okay. This flare up or these symptoms will pass. I can get relief. So kind of goes into that like mindset. I can get relief. This is not forever. You know, you don't want to go down that catastrophizing rumination spiral. And I mean, that's where I would start. I don't know if that's where you pulled it from, but
That's beautiful. That's
Okay.
beautiful. And next one, top 3 travel tips for traveling with IC or vacationing.
I love that because summer's coming up.
I know.
Hydration. You need to hydrate ahead of time. You know, if you need to stop an hour or 2 before your flight, like do what you got to do, but you need to make sure that you're hydrated. If you're somebody who needs to be in an aisle seat, like that gives you peace and it is less stressful for you. I get it. I used to struggle with getting like a middle seat or a window seat. So maybe it's worth it to pay the extra fee if you're on one of those budget airlines that I always fly, or like get closer to the bathroom. But that's something that can be helpful for people. And just have some breathing exercises or like maybe a meditation that you can listen to on your phone when you're sitting there, and really just try to just breathe. I mean, it's going to tell your nervous system that you are safe, you are going to be okay. Also, I'm going to add a 4th. Stop caring about what people think of you. Stop. If you have to use the bathroom multiple times, so be it. But like, I think a lot of people are afraid that their seatmate or their row mates or the people that they're passing on the way to the bathroom are going to be like judging them. And like, if they're judging you, that's a them problem. That's not a you problem. Like, you need to prioritize yourself. And I think once you let go of that fear, I think you're going to have to actually pee less in the moment.
I love that you mentioned the airplane thing because I don't have bladder issues in my everyday life, but I have them on airplanes because I'm a nervous flyer and I get stressed about that. So I always book an aisle seat, or I have to like know the person next to me to book a window or a middle. But I used to stress about that so much. And I was like, oh, people are going to see me get up multiple times. And now I'm just like, you know what? I don't care. And it was like a nice realization to be like, people aren't thinking about me. It's not about me.
My boyfriend said to me, he's like, people don't care. And also, a lot of people want to stand up in the middle of the flight. Like, you're giving them a chance to stretch their legs. Like, they're
True.
probably thanking you for this. And that honestly helps me.
That's a good point. I also, Amanda, I forgot that you are a nervous flyer.
Yeah.
That's
I'm
so
a nervous
unexpected.
flyer.
Yeah, I internalize it now. It used to be way worse. But when I fly with Hannah, what did you say? You're like, I've never gone to the bathroom on an airplane or something?
Yeah, I don't
That's
do that.
wild
Except
to
for
me.
when I went to Spain, because that was a longer flight. I had to, but no, I usually make it through.
Wow.
But you know what? Yeah, but I do fart in my sleep. So
We all have our thing.
we all have our thing.
Oh my God.
I think everyone does that though.
One time, I'm going to tell a quick story. It was right when we started dating, me and my boyfriend. He went to, it was a 6 a.m. flight to Nashville. We get on the plane, he goes to the bathroom right away. And this is still new, so he didn't like tell me he's going to like go take a shit on the airplane. He could not take off because he was in the bathroom.
Oh my God.
And the flight attendants were knocking on the door. And they were like, hey, we're kind of waiting for you. And he's the type that's like, I'm going to take my time. And just like screw with everybody. And then eventually, like, there was a bit of a delay, but eventually he walks in. And I was like, do you realize we were waiting for you? And he's like, yeah. So here we are 6 years later, we're still dating.
Oh my God.
I would be like mortified.
I'd be mortified.
That's so funny that he was just like, yeah,
Could care less. Like, we couldn't be more opposite. I'm so like high strung, high anxiety when I fly. I take my Xanax, and he's just like eats a whole pizza beforehand. He's playing his Nintendo DS. Like, it's just so funny.
That's so. I need to embody more of his energy.
Okay, I feel like I'm more him on a flight.
You are.
And Amanda may be more you on a flight, but I'm not taking a shit on the airplane. That's not me.
But like, if you had to, like, are you gonna hold it in or are you gonna go?
True, I'm gonna go.
Yeah.
Yeah.
Do it.
I'll poop anywhere.
I'll poop anywhere.
Yeah.
I can't, but I know I should.
It is rough when there's not a squatty potty, though. I'll give it that.
It is. And if you miss your poop window, for me, I'm screwed after that. Like, it's like Constipation City.
Yeah.
Mm-hmm.
Yeah. Oh my gosh. That sounds like you guys are a good match, though. You balance each other out.
Oh, yeah.
I love that. I have one more rapid fire question. You ready?
Yes.
A common thing you hear from clients that their doctors tell them that don't align with how you treat. So it'd be like maybe a medical gaslighting example.
My brain immediately went to the follow the IC diet forever, or pelvic floor PT probably isn't going to help you. I can't freaking stand that. Or get a hysterectomy. It might help.
Oh.
I've heard so many absolutely batshit crazy things that doctors have said that I'm just like, I don't understand how you have a degree.
That's crazy.
It's wild.
Hysterectomy. What?
Yeah. Or just like drink a glass of wine so you can relax.
Oh,
Isn't that easy?
That one pisses me off so much.
That one's a big trigger for me.
Yeah. Yeah, these are all things that we hear as well.
Callie, it was so great talking to you.
Can you tell our listeners where to find you?
Yeah, they can find me literally anywhere. I mean, somebody told me the other day they found me through ChatGPT. So I'm like, okay, I'm in your face. I'm on Instagram and TikTok at Callie K Nutrition. I'm on random things like Pinterest and, all the things. And then my podcast, you already mentioned, ICU. It's IC space YOU. And then, yeah, I mean, if somebody wants to work with me, my Road to Remission program is the shit. It's getting people their lives back in a matter of 3 to 6 months. And you're surrounded by women who are going through exactly what you're going through. And it's just really an empowering space to be in. And I'm not just gassing it up because it's my program. Like, it is so awesome.
Amazing. Thank you so much for being here. This has been insightful and a really fun conversation. You were a great guest on the pod, so we're excited to continue chatting with you afterwards too.
Thank you. It was so fun to be here.
Guys, make sure you're following us on social media at Pelvic POV.
And make sure you go to pelvicpov.co to get a Pelvic Freak shirt and leave us a rating on the podcast. Go listen to Callie's podcast, the ICYOU podcast. If you struggle with IC, overactive bladder, or you just want to learn more, it's on Spotify as well. Are you on Apple Podcasts as well? Everything? Mm-hmm. Beautiful.
And YouTube.
We will tag Callie's information all in the Spotify bio of this episode, the episode bio. And yeah, Callie, do you want to do the honors of our closeout? So we always say bye, pelvic freaks. If you want to initiate that, should just say bye to our listeners today.
Yeah. Bye, pelvic freaks.
Bye, pelvic freaks.
Pelvic freaks.